So I would say the majority of kids that we see, a lot of them have had interventions unless we've been involved in their care. Our gastroenterologists are of the mindset that most kids respond to surgical therapy, and some of the medicines used and the dilatations are not effective. And essentially, if you don't cut the muscle and you just use a balloon to dilate it, it's going to be temporary if you have symptom relief. Botox injection works to relax the lower esophageal sphincter. That's also an endoscopic procedure done by GI doctors. And a lot of times GI doctors will say, let's do the least intervention here and see if it works. But almost 100% of the time, it's only a temporary fix. And for a child that has a long life ahead of them, surgical myotomy actually gives long-lasting results in better than 90% of kids. Standard of care, although now with increasing experience with the poem since 2010, most surgeons will do either a laparoscopic or a robotic Heller myotomy. For kids, robotic surgery is not really effective because the instruments are really large. So we can do laparoscopic surgery, in the smallest kids we do for Heller myotomy have been between 3 and 8 months of age. So those are kids we would do a lap Heller for. For kids larger than 3 years old or 2 years old, they're big enough that they can undergo a poem. So we've done kids in that age size, and weight size and age range. But the Heller myotomy basically comes from the outside and cuts the muscle. And then oftentimes you have to dissect around the esophagus so you can create a hiatal hernia or a reflux from that operation. So you have to do usually some type of anti-reflux procedure. And for achalasia, the anti-reflux procedures are partial wraps, which are by definition are less effective than a full wrap.